Guys, so I'm welcoming you at my YouTube channel PT Freaks, and in this video we are going to learn about the most important topics for the PG entrance examinations, and that is the tumors. Okay, so first we are going to discuss what is the most common benign tumor of the bone that is your osteoid osteoma, and which is the most common malignant tumor of the bone, that is your osteosarcoma. Okay, so we are going to see one by one. So first is your osteosarcoma, then we are going to discuss your Ewing sarcoma, GCT, which is osteoclastoma, chondroblastoma, multiple myeloma, fibrous dysplasia, simple bone cyst, and aneurysmal bone cyst. So osteosarcoma. We are going to discuss about this osteosarcoma. So see, when the osteosarcoma, the most common age group is affected, that is a 15 to 25 years of age group. So first we are going to start with the age groups. That Ewing sarcoma, that is commonly affected at the 5 to 15 years of age. Okay, then GCT, which is your osteoclastoma, which is happening at 20 to 40 years of age. Okay, and at which is the most common site in the bone, so that is we are going to remember by the mnemonics, so which I made. So this is like osteosarcoma, that is happening in the metaphysis of the bone, so you can remember as the OM, osteosarcoma, that is occurring in the metaphysis of the bone. Then ED, so if you guys ever, though that is for ED is the mnemonics, E stands for E, then D is for दावत. Okay, so after all ईद के बाद हमेशा दावत होती है, ठीक है. सो ई इज़ फॉर डी, सो वी आर गोइंग टू रिमेंबर जस्ट लाइक दैट. सो ई इज़ फॉर Ewing sarcoma and D is for your diaphysis, that is happening at your diaphysis. Then GCT is your osteoclastoma, the mnemonics is your GE. G stands for your giant cell tumor and E stands for your epiphysis. It is, you can remember as a general examination, like G is for GCT and E is for epiphysis. Okay, so let's look on the how in the X-ray, in the radiograph of the whatever the like bone is affected. So we can see the sun ray appearance. So if the patient is having an osteosarcoma, what we can see in the X-ray, sun ray appearance and Codman triangle. What we can see in the Ewing sarcoma is an onion pill appearance. What we can see in the GCT and osteoclastoma is a soap bubble appearance. So this is how you can differentiate these two tumors. Then the most common site, that is where the osteosarcoma is occurring, is your lower end of the femur and your upper end of the tibia. The most common site for the Ewing sarcoma is just same as your osteosarcoma, like lower end of femur and upper end of tibia. And GCT, that is osteoclastoma, is happening at the lower end of the radius. Okay, so let's further with the chondroblastoma. So this is the most common, it is occurring at the 40 to 60 years of age. It occur anywhere in the bone, means no fixed at metaphysis, diaphysis, or which region is of the bone is affected. So in that we can see the mortal calcification, and it is seen in the upper end of the femur. Okay, now let's move on the multiple myeloma, which is derived from your plasma cells, and serum calcium is elevated. Here there is also serum calcium is elevated in the osteosarcoma. And alkaline phosphate, which is totally normal in case of your multiple myeloma. Total protein will be increased, ESR, erythrocyte sedimentation rate will be increased, but hemoglobin will be decreased. And also there is an albumin globulin ratio, AG ratio, that is going to be altered in the case of your multiple myeloma. Okay, now let's move on further with the fibrous dysplasia, which is what you can see in the X-rays, your ground glass appearance. Now simple bone cyst. So simple bone cyst, you can see the most common site is the upper end of the humerus, and for aneurysmal bone cyst, the most common sites are long bone ends, like your femur and humerus. Okay, so that is lower part of and the lower end of your humerus and femur. Okay guys, in this video means in this all this information I not covered all of the things, but just an entrance perspectives, what is the most common and important points, that is what I have covered in this video. Thank you so much everyone for listening me very silently.